Today, President Donald Trump officially declared the opioid epidemic a national public health emergency.
Families, communities, and citizens across our country are currently dealing with the worst drug crisis in American history, and even, if you really think about it, world history.
However, critics say this move falls short of recommendations he received from his commission. The declaration will reportedly last for 90 days, but will not provide additional funds needed to fight the crisis. According to the Department of Health and Human Services, the Public Health Emergency Fund currently has a balance of just $57,000. Since 1999, the nationwide opioid problem has quadrupled the number of overdose deaths resulting from prescription painkillers and heroin. The CDC reports overdoses claim more than 90 lives a day. And that's not all. Pharmaceutical companies are raking in record profits to the tune of billions of dollars a year. Meanwhile, several lawsuits have been filed against the very pharmaceutical companies that manufacture and distribute prescription opioids. For more on this, I was joined by Dr. Andrew Tartarsky, an addiction psychologist and clinical advisor for the Office of Alcoholism and Substance Abuse Service of New York State and founder and director of the Center for Optimal Living in New York City. He is also the author of the book Harm Reduction Psychotherapy, a new treatment for drug and alcohol problems. I first asked him, why is the U.S. facing such a huge opioid crisis?
Important for us to consider that Black and brown and poor communities have been struggling with problematic substance use for decades. And unfortunately, it's taken this problem to, seep into white, middle class and working class communities for the nation to wake up and recognize that there is a problem. I think that the problem is multiply determined. I certainly think that availability of opioids is one contributor, but I also think that we as a nation have an oversimplified view of addiction. We tend to look for like the magic bullet or the demon cause. So in this case, we're looking at the drug, the availability of the drugs. And I think that we need a much more comprehensive complex understanding of addiction, the nature of addiction, that considers that, social context, the decline of, economic status in these communities is a major contributor to suffering. And we need to adopt what I call a psychobiosocial understanding of addiction that considers that psychology, suffering, the biology of the substance, and social context all come together to express themselves in addiction. And so not only do we have an inadequate understanding, I think we have an inadequate treatment approach, which by and large dumbs down, oversimplifies the problem. And we need, a much more comprehensive approach to treatment, to address this problem.
Andrew, President Trump, he's acknowledged the U.S. faces an opioid crisis, but he doesn't plan to allocate new funds to combat it, even when state officials say it's critical to respond to the drug epidemic in that way. So what's your response to that?
My response is that this, on the one hand, his gesture is potentially a valuable symbolic gesture to acknowledge that this is a serious problem that needs serious attention. But the inadequate funding is a major contributor to the problem that we have. We do not have enough treatment in this country. We need to make a total shift in our allocation of funds to make treatment available that is comprehensive treatment along the lines of what I was talking about, available to everyone who wants it, regardless of their ability to pay. And, I think another dominant part of the problem is the misunderstanding of why people use drugs and get into trouble with drugs that is kind of infused by stigma. The stigma maybe, contributes to an inadequate response, an inadequate emphasis on comprehensive, compassionate treatment for all who need it.